Hello, everyone, and welcome to my world. I found an interesting Deutsche Welle News YouTube video where I want to react on because it's the myth of free healthcare in Germany inside the system at breaking point. I also can say that our health system lacks in certain things because when I was talking with different kind of people when they went to Germany, they told me also that Germany have a high prescription rate. So they are not trying to find the curse about your issue. They are more likely to subscribe you ibuprofen or something else, a different kind of pain reliever. And this is an issue what is coming more aware that people are not getting treated well. But let's see what we seeing today. I had just a few seconds before, and what I was seeing was that actually not everybody have insurance in Germany. And this is really interesting for me because it's in Germany. You should have an insurance, and health insurance is mandatory. But yeah, let's see what we can discover today about my country, and I'm really interesting to learn about my health system over there. I'm living in Portugal, but let's see now what they discovered.
This clinic in Hamburg is open to everyone, including people who have no health insurance. Official numbers show that around 70,000 people in Germany are uninsured, and the real number may even be higher. So in a country that's known for its universal healthcare, how do these people get medical treatment?
Germany has one of the world's most expensive healthcare systems, but the quality doesn't always match the price tag. Costs are rising, waiting times are getting longer, many clinics are understaffed. At the same time, many hospital beds remain underused, and bureaucracy is inefficient.
We pay for Mercedes, but we drive a Golf. We are really in a relatively bad situation, which I haven't seen for many decades.
Also da ich auch demnächst Patient sein werde und ich mit einigen Monaten Wartezeit zurecht kämpfen habe, würde ich sagen, dass das System überlastet ist.
The system needs reform. The German hospital
Yeah, I would say the system need to reform, but also the standard or how the pressure is in the system in Germany. It's really high, the pressure, and the money is not meeting the criteria what they are earning for the daily life because they normally living in shift system, so they need to work in the morning, in the evening, or in the afternoon, and this to comparison to have a family or planning a family is really hard as well. So the system is not attractive to so many people, and also customers, if you're working with customers or with patients in general, they're not always friendly. So you need to have always a good attitude or saying, oh yeah, I like my job, I'm going to my job and all that kind of things. But if you're working with human beings, it can be really difficult. And here, what we have in Germany in general, this section, what you're providing for human beings is not meeting the criteria money-wise. So you earn most likely more money if you're going to perform in the IT section than in the public health section. So it's just burning out the people, not trying to reform or doing it better in the future. And I think this is the main issue we are facing in Germany as well.
Association has even called 2026 a Schicksalsjahr, a make or break year for the healthcare system. And the government is promising to implement a major healthcare reform. Health Minister Nina Waken didn't sugarcoat it.
We're dealing with inefficient structures, unsustainable financing, staff shortages, poor digitalization, and way too much bureaucracy.
Digitalisierung mit einem Übermaß an Bürokratie.
So what exactly is going wrong, and what are possible ideas for solutions? Germany has the most expensive healthcare system in the EU. In 2023, the country spent around 12% of its GDP for healthcare, more than any other country in the European Union. However, in terms of avoidable deaths, its performance is just average. In Germany, more than 83 deaths out of 100,000 inhabitants were considered avoidable. In Sweden and the Netherlands, it was less than 60 deaths.
Already 25 years ago, the WHO produced a first international ranking where we at that time were third in expenditures, but 21st or 22nd in outcomes. And at that time, the then chairperson of the academic advisory board to the ministry made his famous sentence, "We pay for a Mercedes, but we drive a Golf" in healthcare. And I think that
We'll come back to that.
And there also the thing is, or what I experienced, that especially we have a lot of people, foreign people or refugee people working in the section, and have an uncertain state of be willing to stay in Germany. And I saw also that some people even working in this section and have everything required, speaking German and having paying for their house and all the kind of things, they get deported by the government. And this is an issue we're facing as well, and we need to address that as well, because they portraying immigrants in Germany really badly, and when they are integrated, they also suffering to deport them.
In a moment. But what do these rising costs actually mean for the average person and for the economy as a whole? To answer that, we first need to understand how Germany's healthcare system is funded in the first place. Most people, nearly 75 million, are covered by public insurance. Half of health insurance contributions are financed by employers and half by employees. These contributions have risen steadily in recent years. In 2026, an average of 70.5% of gross wages will go toward health insurance, regardless of your health status or age. This applies to everyone with statutory health insurance. Uniquely in Germany, you can completely opt out of the system. Around 8.8% of people in Germany have private insurance, mainly high-income earners, the self-employed, and freelancers, which drains financial resources from the statutory system and contributes to the problem. The insurers' expenses continue to rise, while their revenues decline. In 2026, insurers face a €2 billion shortfall. By 2027, that gap could explode to 12 billion. One more reason for that, the demographic change.
The number of patients and the percentage of patients above 70, above 80 years old will considerably increase, and that is putting additional pressures on the expenditure side.
Germany has one of the highest amounts of hospitals per capita in Europe. This ensures good access to care, but also creates significant inefficiencies.
We have among the highest numbers of beds per 10,000 patients, and we are using these beds extensively. In international comparisons, it's demonstrated in many areas that we do treat patients within a full hospital stay, where other countries far more common do it without a hospital stay in the ambulatory setting.
And the costs for this care are increasing. With new breakthrough treatments on the horizon, the system is under even more pressure.
At the same time, we see that in the drug industry, in the medical device industry, there is a lot of progress being offered. Yeah, I mean, if you look at Alzheimer, if you look at cardiovascular diseases, there are some breakthrough therapies approaching. But then the question is, can we afford to be as generous as in the past to really fund all these therapies?
Another cost driver, Germans go to the doctor quite often.
Yeah. So we also call it dog holiday, because if you are saying you are sick and not need to have a visit and can stay home, you get still 100 of the payment. So this is I would say still it is still a good thing to, if you're getting sick, that you have your full payment. So, for example, here in Portugal, if you get sick, you don't get your full payment, and the first 3 days are deducted by your salary. So, and I think this in an environment that you cursing if you try to go sick to your to workplace and all that, and cursing that other people get sick, everybody losing money in this certain of sense. And to isolate the person who getting sick and allowance to stay at home to not get affected the others, I think it's a better impact for the economy than to deny the money access and lose money if you get sick just because of a natural curse. We always get a flu or something else, and I think this should be something we should consider everywhere in the world if you get sick to get the payment. But of course, we should also have the limitation about that, because in Germany you can also do dog holidays, and then if they don't have time to visit you and say, hey, I'm sick, I can't go to work, and you just make it by phone call and all that stuff, this it's have also an impact in the economy.
According to an OECD poll, Germans in 2023 went to the doctor 9.7 times on average. This is more than the OECD average of 6.5.
I think there is an overuse because people are used to go to the physicians very regularly and very often. It's also an incentive aspect from the provider side, because the remuneration system, the fee schedule for physicians rewards that people come back. Yeah, you fill your offices regularly by inviting them to come back. That's a part of the business model of physicians.
And this leads to long waiting lines. On average, the waiting time for an appointment with a specialist in Germany is 36 days. This is one of the things bothering people with statutory health insurance the most.
Facharzttermine sind schwieriger, wenn man nicht privat versichert ist. Hautarzt ist schwierig.
Erstmal die längeren Wartezeiten, und dann versuchen Sie mal telefonisch bei irgendeinem Arzt, bei vielen Ärzten, sage ich mal so, einen Termin zu bekommen. Die gehen gar nicht erst ran.
Thema deutsches Gesundheitssystem. Wie zufrieden sind Sie denn? Was ist die Lage?
Also da ich auch demnächst Patient sein werde und ich mit einigen Monaten Wartezeit zurecht kämpfen habe, würde ich sagen, dass das System überlastet ist.
For some people, the problem isn't the waiting time. It's getting any treatment at all. There are people who have no insurance coverage whatsoever.
Always, if the economy is in a crisis, then the number of people without health insurance is increasing as well, because then you are falling out of the labor market, you may fall out of your flat, and then the likelihood that you lose your health insurance is there, and it's an increasing problem. People can come back, of course, but then the health insurance system wants them to pay also the lost contributions of the time when they were not in health insurance, which of course is not an invitation to come back.
So what can these people do when they get sick? Let's take a closer look.
This clinic in Hamburg is open to everyone, including people who have no health insurance. Official numbers show that around 70,000 people in Germany are uninsured, and the real number may even be higher. So in a country that's known for its universal healthcare, how do these people get medical treatment? Let's take a look inside.
Bronwyn Margolis is managing this free clinic that treats uninsured patients. People.
For me, it's a little bit curious how those people get uninsured. Of course, you have people on the street, living on the street in Germany as well, and it's the government. It's really ridiculous to saying that we get rid of those people and have housing systems and all that at the end of 2023. No, 2030, and I was like, okay, this is a joke. In 4 years, to not have any homeless people, this is a joke, and this is how far our government at the moment is. How far they are, or how delusional they are in the opinion of the society, what they are facing in Germany. They're saying it's a good and great country, but they're not doing anything for the country. And this is the issue what we are facing at the moment in Germany, that people are getting more and more really frustrated, and nothing get done in Germany for the people. But what the people are doing, they're going to the far right. And I mean, with our history, far right was not always good. So I would lean more to the leftists who have a progression way to see, okay, how we can implement different kind of things that really everybody's covered and have a better life. But so far, yeah, it's the prediction there, it's getting probably most likely worse in Germany than really before it's getting better.
Who have fallen through the cracks of the healthcare system.
Es kommen Männer,
We see men, women and children.
Kinder, Menschen, die auf die
People
Straße
living on the
leben,
streets
Menschen, die
and people without a secure residency status.
Aufenthaltsstatus haben.
Being uninsured is rarely an isolated problem. It often goes hand in hand with uncertain residency status or unstable work. They don't have health insurance because, for example, they can't get work, at least not jobs that come with social insurance. There are also many day laborers who can only work a few hours here and there. Those jobs offer no protection either.
Und dann natürlich die Familie.
And of course, their families are affected as well, their children too.
Kinder sind auch mit betroffen.
By offering multiple types of consultations, the clinic aims to address as many concerns of their patients as possible. We offer general medical consultations, twice a month a gynecology clinic and once a month a pediatric clinic. We also provide social counseling. These sessions address social issues and help patients find a way into the system. Today's doctor on shift is Matthias Plininger, who ran his own practice for decades. Now, at 80, he's retired but still volunteers here. Like many other patients, this woman doesn't want to appear on camera, fearing consequences or stigma. Her symptoms began 2 weeks ago.
It's pain me.
What this makes me really sad is, first of all, that he's in his pension and still worried. So he's really honorable on that part, that he is enjoying his pension but still try to help people. So, and I think this is most common, that this should be the first place to becoming a doctor, helping people. And the other is that you have that even they don't want to show because they are fearing that they get deported or something like that. So it's heartbreaking to see that even in the pension of this doctor, that he's still trying to do the best thing out of it and help people. But this is, in my opinion, it's not really a pension if you be that. Of course, he's choosing that. He don't need to do that 100%. But I mean, what we just learned about the health system in Germany, some people get kind of forced to still doing their job because it is not efficient in Germany. And if we wouldn't have like really altruistic people in the society helping out where we have shortage, it's our society would be even worse than that. So those people are the real heroes.
My ear pain me and my head pain me.
During his shifts, Plininger encounters the full spectrum, from minor infections to cancer diagnosed in late stages. We see this often. People come in with untreated illnesses because they simply had no way to see a doctor, or if they could, it would have cost them far too much. To Matthias Plininger, helping here is a responsibility and a matter of principle. I find it unacceptable that in a wealthy country like ours, people are simply left behind, and when they fall ill, they have no protection. That urgently needs to change. Access to healthcare is a human right, and it must be upheld. Around 70% of patients come regularly. This man has been coming for almost 10 years. He speaks little German, so they communicate via an app. 1/7/2017, yes. In Germany, yes. In severe cases, or when a specialist is needed, the clinic reaches its limits. That's when a network of doctors steps in. Or clearing centers, places that help patients navigate the system, take over. But sometimes even that doesn't help, leaving Margolis with a heavy heart.
I always leave the consultation with mixed feelings. On the one hand, there are beautiful encounters, moments when we can actually help people. But on the other hand, I wish they had access to much better care, that they could just seek medical help like anyone else, instead of having to wait until our next Tuesday clinic.
Health insurance in Germany has been mandatory since 2009, yet many people still fall through the cracks. And until this changes, initiatives like this continue to fill the gap.
The official numbers are totally underestimating the real problem. Experts estimate that we probably have between 500,000 and 1 million people without health insurance coverage.
But back to those with insurance. Many feel the daily strain of rising costs and endless waiting lists. We can see that in this survey from 2025. Over 30% of respondents said that they were no longer satisfied with the healthcare system. In 2021, this figure was only 10%. So the big question is, what's being done about it? The German government has set up a commission to draft a reform plan with results expected in March. The main goal: to stop insurance premiums from rising further. Politicians are debating about how to do that. Either cut costs on the services or find the money from elsewhere. But in reality, there's no one-size-fits-all solution.
I think there are several reform steps which we really must take. One is making hospitals more efficient, which means centralizing the hospital structures and making sure that hospitals only treat those patients where they have a high expertise. At the same time, we must reduce the capacities of hospitals. And this means
this is a good point, because I was reading Invisible Woman, a really good stand here, because they also said women caregivers in hospitals that say that the hospital is so built that there's a lot of blind spots over there, that some women get harassed by customers or by patients and all that kind of things. And they wanted to, when you consider the safety of a woman in their workplace, then they try to centralize like a station where you have an overview, where you can view all patient in from one room kinda. And I think this is also more efficient, because you have more better access or quicker access to the patients themselves. So this, considering of building hospital and how the hospitals should be rebuilt on efficiency, should be more in considerable with talking with doctors, female doctors, different patient, what is good, what is bad, what is the best outcome of it, and how we can treat the best, like to have an emergency room what is way more efficient and not have stages, and being more focus on it, to have the fast the fast alignment to treat this patient in a suffering state. And I think with the volume of people we have, we need to rethink how we build things, and we also need to rethink how we actually perform our hospitals in general.
Means that we also must increase further the incentives to do ambulatory treatment instead of inpatient hospital treatment. The second thing, I think, is we must increase the use of digital tools systematically. The third thing, I think,
really liked it to see what they was talking about, and I really enjoyed the short reaction on that. If you liked it as well, please sum up for my channel. That would be amazing. And of course, if you didn't subscribe, the little thingy there to subscribe to my channel would be nice as well. And hit in the comments how write how your health system is. I know in America it's not really existing. It is like health insurance and all that stuff. It's really expensive over there. This is what I'm knowing. Here in Portugal, we have a free system. We have also a private system, and it's differ a little bit. But so far, I have good experience with the health system. I get good treatments and all that kind of things. So I can't really complain. It's sometimes a little bit more expensive, but yeah, that's all I would say. So I have different point of view in health system, but I'm now really long out of my German health system because I live now almost 7 years here in Portugal. And yeah, if you like it, thumb up, hit in the comment what you think about it and how the state of health system is in your country. Maybe we can learn from each other. It would be amazing. And of course, if you have a good, I would say, have a good evening, a good morning, or a good afternoon. It's depending when you watching this. And of course, what else to say? Yeah, just enjoy and make your hot coffee, tea, or a hot chocolate, and see you soon. Bye bye.